Morning, everybody from Bongolo Hospital in Gabon. We wanted to take an opportunity to give you a little tour of this facility and allow you to meet some of the Christian Health Service Corps folks working here at this facility in rural Gabon. So join us as we take a tour of the hospital and meet some of our team.
We're David and Josie Scabdall, and we get to be here with Christian Health Service Corps. This is Bongolo Hospital in Gabon, the west coast of Africa. I get to take care of babies, preemies, and sick babies at the maternity ward. And David is a general surgeon.
So I get the joy and privilege of working with our PACS, or the Pan-African Academy of Christian Surgeons training program. And we have 6 residents right now from 4 different African countries who will spend 5 years here and then go back to their respective country and work at the mission hospital there.
That's awesome. So you want to show us around the hospital?
Absolutely.
Okay.
We're at the Bongolo Hospital, and we have 158 beds and a variety of services. So we have just here the cabinet dentaire, our dental technicians. Behind that building is the maternity ward that you can't see right now. This row of doors is offices for the surgery department, our OB-GYN, anesthesia, radiology, the x-ray machine, and there's an office for the national insurance program. Straight ahead is the blocks, the operating rooms, and the surgical recovery room. And then beyond there is where the surgery patients stay in the ward there. In the far back to the right is the waiting area. Benches covered from the sun and the rain. And then the consultation works out just in general medical consultation. And then here we have the salle d'urgence, of the emergency room. Behind that building is the pediatric ward that we can't see, but you might be hearing the children. This is our medicine ward for adult medicine inpatient. And on the opposite side, all the rooms there are for our TB patients, which they stay here to have a better continuation of their treatment or adherence to treatment protocols. We also have a lab, the ophthalmology clinic and surgery. And then our approvisionnement is the storage for all of our medical supplies and medications.
We are in one of my favorite places in the hospital, which is the pediatric ward. We have our pediatric consultation and emergency room in this building here, and then this is our inpatient pediatric ward, playground, and yeah.
So our eye clinic is here. They see patient consults on the first floor, and they do surgeries on the second floor. And we are the only eye clinic in Gabon that does some of the surgeries that Dr. Wendy Hoffman does. Dr. Elise Baroa is from the Republic of Congo, was a trainee and then has stayed on here. We also have a current resident is from Cameroon, who is training to be an ophthalmologist. And we have another doctor from the Samaritan's Purse PRP program who's an ophthalmologist there now. We have our little laboratory here, and then the bulk of that building is our approvisionnement, which is storage. And so we have, we'll get kind of feast or famine, a whole container worth of medications, and then when they get used up, they're gone. We wait months for another container or shipment of meds. But they're things that have been stored in there for many years and things that we wish were stored in there. But it's a great climate-controlled area to keep our meds in.
Yeah.
All right. So this is where our generator is when the power cuts out, and called the depot, but it's storage of extra hospital beds. Often a lot of equipment that doesn't work now, hoping saying, come on, let's fix it. We do have a fire truck that was sent on a container. It's a classic American big red fire truck. And we've actually had to use it with fires that have gotten up into the houses in the village here. We have our soccer field, basketball court. Most work out there today. Yeah, so, I mean, the first missionaries came here
Up the Loetzi River in 1937.
amazingly.
So yeah, 1937 was the first missionaries arrived and started working with the local people. This area of Gabon was called by the French the white man's graveyard. So the French would often come here and be murdered. Or die of malaria, some sort of tropical disease. And so Don Fairley, so wife's name. I will forget his wife's name. I'm really sorry. Came here in 1937, and they started working with some of the local tribes and training pastors, and just slowly built the church, which 100 years ago, the name of Jesus Christ was not even known here. There were two sort of demon gods that ruled this jungle area that the people swore allegiance to. And it's just amazing to see, since 1937, what God has done to make the name of Jesus known, and just watch people's lives just flourish.
So the church was asking for a doctor from the Christian Mission Alliance because they couldn't train the pastors fast enough. They were dying from tropical diseases or other health issues. So they specifically requested a doctor come. And so Dr. Thompson started the hospital, and with his wife and Carol Orson, also the nursing school. And it's grown, I think each year we get, whether it's the nursing school or the call house for the anesthesiologists, there's a new building going up each year since the 70s.
Yeah.
So at the beginning of Bongolo Hospital, the surgeon and two nurses came to start the hospital, and they immediately started a nursing school. And so we've had excellent nursing staff ever since because of the nursing school. This is part of their training, and so this room is where they get to practice putting IVs in on the dummies and practice their various skills of drawing up meds, giving meds, and any of those hands-on activities.
That's great. How many students do they have?
So they take 20 students that go through 3 years of training, graduate, and then they start over with another class. And so all 20 students are together their whole 3 years. And then most of them stay here and work here in various departments. The midwives continue on for an extra year of training to become midwives. So they graduate from the nursing program and then become nurse midwives with one more year of training. And so they learn their skills throughout their program in different departments. And then when they graduate, they've pretty much chosen which department they'd like to work in. So it's a very smooth transition to have great employees when each class graduates.
You're a midwife, and you're involved in training the midwives,
yes,
right? Yeah.
So I got to, along with Dr. Alicia, help teach the 3 nurses that graduated last year, and just recently in the last month graduated from their midwifery training program. So that was a joy for us to help train and then work with these 3 midwives.
That's awesome.
This is our PACU, or also known as REA. Very, very busy during the week when we have a full operating schedule. Not so busy on the weekend. But yeah, we're really blessed to have trained anesthetists who often are participating closely in our PACU.
Well, you have an anesthesia training program here too, right?
Yeah,
So you train nurses, nurse midwives, and anesthesia providers. And surgeons. That's amazing.
And we're starting a primary care training time.
It's fantastic. Joseph, can you tell me a little bit about the baby?
Yeah, so we have preemie. I'm not sure how many weeks early, but 1 kilo, 700 grams, that has some other malformations and her feet, facial features, but she can't eat. We couldn't get a nasogastric tube down, so we knew there was something blocking, and it turned out to be a esophageal fistula. So they're trying to create an opening that food can go down and block off the connection to her trachea, so she's not breathing the food also. So at the moment, shipping her breathing and doing this operation on such a small space is difficult, but looks like they're doing a good job right now.
This is David actually. She has her twin sister, Tariel.
They were born premature, but are growing well in our box here. These boxes are really light bulbs with a thermostat, and when we need to increase the temperature, the light bulbs turn on. It can protect them from mosquitoes and malaria and other infections with just a plexiglass cover. And it does an amazing job protecting our babies while they're growing. These little girls just get breast milk through a nasogastric tube, so they don't have to expend any energy to eat, and all they have to do is stay here and stay warm and grow. So these boxes do an amazing job for us. I also have this lovely pool. When you're at Resort Bongolo as a missionary, you get tennis courts, soccer field, basketball court, pool.
Awesome. We missed the tennis courts. How did we miss those?
Well, they're with the basketball courts.
Oh, okay. All right.
Same.
Pickleball.
And pickleball.
It's a new step for mission stations all over the world. We're leading the way in providing a coffee shop for our mission station.
This is awesome.
This was a vision by our former team leader and with some help from the church in the United States. We provided some of the funding for this. But the idea was to have a common space for both visitors and the mission team. A lot of our team will use the space for working space, or when visitors are here, just enjoying time together in a shared common space.
That's awesome. So